Welcome back to the Health Tech Explorers channel. Today we're diving into one of the most exciting developments in AI and medicine, OpenAI's HealthBench. It's not just another benchmark, it's a global effort to measure how well AI truly understands the complexity, urgency, and empathy behind real medical conversations. Built with input from hundreds of doctors worldwide, HealthBench is changing how we evaluate trust, accuracy, and safety in medical AI. Let's explore how it works and why it's setting a new gold standard for healthcare technology. Imagine a world where artificial intelligence truly understands not just the words we say, but the intent, urgency, and nuance behind every health question we ask. OpenAI's HealthBench is a huge leap toward making this a reality, setting a new gold standard for evaluating how AI systems perform in health and medicine. What sets HealthBench apart is the striking realism and clinical depth of its testing process. Built with the input of 202 practicing physicians from around 60 countries and spanning 26 medical specialties in 49 languages, HealthBench simulates 5,000 real-world health conversations, everything from urgent emergencies to complex, ambiguous follow-ups between patients and clinicians. Each conversation is evaluated against a custom, physician-developed rubric, so every nuance, from the clarity of communication to the accuracy of advice and the adjustment for local healthcare norms, is accounted for. Many previous benchmarks for medical AI were little more than exam-style questions or diagnoses from single specialties. They often failed to capture the unpredictable, multi-turn nature of actual health conversations. HealthBench flips this script by demanding more detailed, context-sensitive, and, above all, safe responses across a true variety of roles and medical realities. Some conversations test if the model recognizes an emergency when it hears one. Others see if the AI is able to adjust its language for a patient versus a clinician, or express uncertainty when the available evidence is weak. There's even a focus on scenarios reflecting varied global resources, so that advice makes sense whether you're in a well-equipped hospital or a remote rural clinic. What's also revolutionary is how these model responses are graded. Each reply is scored by AI model graders, referencing thousands of physician-generated criteria, ensuring responses match what real-world healthcare professionals would prioritize, be it accuracy, empathy, or clarity. The sheer detail in these rubrics, totaling nearly 50,000 unique evaluation points, means every aspect of a model's answer is scrutinized. Scores from HealthBench genuinely reflect the practical, safety-critical demands of actual clinical environments, not just theoretical knowledge. Recent tests show OpenAI's frontier models like GPT-4.1 and the O3 series are not just progressing, but improving rapidly in both reliability and real-world safety, with error rates dropping by double digits in just a few months. This is more than just a competition to see which model performs best. It's about creating truly meaningful progress. By raising the bar and being intentionally unsaturated, ensuring current models don't top out but have clear room for growth, HealthBench gives the AI community a target that's as ambitious as modern healthcare demands. For patients and clinicians alike, this means the next generation of AI will be trained and measured not just on textbook medicine, but on the realities of human health, the ambiguity, complexity, and urgency that make every case unique. HealthBench is already changing how leading AI developers approach model design, putting patient safety, quality, and adaptability front and center. Researchers and companies beyond OpenAI are referencing this benchmark in peer-reviewed studies and industry reports, highlighting its role in guiding safer, more trustworthy LLM applications for health. The introduction of consensus-tuned and hard-mode subsets within HealthBench enables even more robust comparison and measurable progress against the highest possible standards. In essence, HealthBench is more than a test. It's a roadmap for AI's next frontier in medicine, one where technology doesn't just answer health questions, but earns the trust of people and professionals alike, no matter where or how those questions are asked. Thanks for watching. If you liked the video, don't forget to give it a thumbs up and subscribe so you don't miss any future videos. See you next time.